Good evening, everyone. My name is Sharon Moreno, and I'm a family nurse practitioner. I practice locally in the great area of Rio Grande Valley and see patients via telemedicine all over the state of Texas. And so I want to welcome you to my weekly segments where I provide medical information every Wednesday evening. And so we're here. We'll start with our legal disclaimer, which we always start with essentially. In the meantime, that you guys maybe decide on some topics that you're interested in. My goal is always to present medical information that's pertinent to the public. So I'd love to hear whatever recommendations you have as far as topics. If not, no worries. I'll continue to create um, different sorts of topics. Okay. So I mentioned we'll start with our legal disclaimer. Um, that's how we usually start our show. And I have a few comments already, so we'll review those. Norma says, hello, Miss Sharon. Hi, Norma. How are you doing? Thank you for joining me every single segment. I have another comment that's from B. She says, hi, Sharon. Hi, B. How are you doing? You've joined me, I think, on a few segments. So thank you for continuing to join me throughout as I continue to do new segments. All right. Again, I always want to remind everybody that I'm available to the community for questions, comments, concerns. I don't charge for questions. I charge for treatment that I offer, but this is my information with some of the services that I offer. I offer weight loss with the use of prescription pills where no diet is required, nor physical appointments. Everything is done via telemedicine. I also offer vitamin B12 injections and offer scheduling for those. Offer steroid joint injections for people who suffer with pain to multiple joints, antibiotic injections and or prescriptions for people who have things like strep throat, urinary tract infections, upper respiratory related infections that are bacterial in nature, dog bites, a variety of things. I also offer refills and multiple prescriptions for a variety of conditions: diabetes, high blood pressure, depression, anxiety, thyroid issues. What I tell people is if you have no idea if I offer the service, which the likelihood of me offering it is pretty high, then just message me. And the way you can contact me is via text 956-640-6963. Tell me who you are and tell me what service you're interested in, and I'll help you. You can also get a hold of me via my messenger under Sharon Moreno on Facebook. If you're interested in a bit more detail and depth regarding services that I offer, feel free to visit my webpage at goldrushhousesolutions.com. I have another comment here from Juliana. She says, hi, Sharon. Hi, Juliana. How are you? And so the topic we're going to discuss today is insomnia. So I know we touched a little bit on this topic last time, for the reason being it was part of issues related with weight gain, obesity, things of that nature. And so I felt like this is a really important topic. I see quite a few patients with insomnia, which is difficulty with sleep. And so, since it affects so many areas of our health, I figure that this is a really important topic to discuss. And so we're going to get right into that. You know me, I'm a person of statistics, so I like to provide some information regarding insomnia and how this affects us. So approximately 10 to 30% of adults experience insomnia. Quite significant, right? Considering the issues that it causes. And we'll talk a little bit about that as we continue with the lecture. Insomnia is more prevalent in older adults and women. I'll be honest, I tend to think that men suffer from insomnia quite a bit. The only issue is that they're not necessarily the best at voicing these sort of issues. They seem to be a bit more timid, or there's issues having to do with culture where they may appear as weak and so don't necessarily complain. But this is an issue that affects men significantly as well. Approximately 75% of people with insomnia can improve their symptoms with lifestyle changes. That's significant as well. because as we start to talk about symptoms that can happen when people aren't sleeping well, you realize that 75% of people can change the symptomatology and or prevent these symptoms if they make some changes in their life, which we're going to continue to talk about that as well. So let's give a little information regarding overview. So just some general information that doesn't necessarily fit into a specific category. So insomnia is a common sleep disorder that can make it hard to fall asleep or stay asleep. So there are actually two different issues. And when I'm investigating sleep, I always ask, are you having difficulty falling asleep? Are you having difficulty staying asleep at night, where you fall asleep okay, and then you're tossing and turning and unable to fall back asleep, or getting up out of bed because you can't sleep? Um, Also, again, as I mentioned, people can wake up too early and not be able to fall back asleep. So you wake up in the middle of the night, and then all of a sudden you kind of just lose your sleep. You're not able to go back to sleep, or it takes a while for you to go back to sleep. If you drain your energy level, it can drain your energy level, affect your mood, your health, work performance, and quality of life. Who would have known that sleep actually affects these areas significantly? It's a big issue. How much sleep is enough varies, but most adults need 7 to 9 hours of sleep at night. And I'll talk a little bit about how I evaluate whether sleep is good or not. Um, it can lead to daytime fatigue, difficulty concentrating, increased risk of accidents, obesity, heart disease, and depression. Again, areas where they're quite significant. Um, we can end up with certain health related issues and or symptoms. So it's important that we address it. So what better topic than talk about the symptoms itself? So symptoms include having a hard time falling asleep at night, waking up during the night, waking up too early, which are the things that we've mentioned, feeling tired or sleepy during the day, fatigue and or feeling tired or sleepy during the day is quite a common symptom. How many people don't feel tired during the day? And sadly, the issue is that a lot of different health-related issues and or concerns can cause this particular symptom. So it's hard to just look at that one particular piece of symptom on its own. It's best if we evaluate that symptom with a variety of other things that's happening in the patient's life. So what are other symptoms associated with insomnia? Things like feeling cranky, depressed, or anxious. So again, it affects our mental health. Having a hard time paying attention, focusing on tasks, and remembering. So you kind of stop and think, how many people have been diagnosed with ADD or ADHD and simply just aren't sleeping well? And if they would sleep better or have sleep that is um, in a place where it's not just necessarily the amount of hours, but where it's more worthwhile, then perhaps they wouldn't have this particular symptom and they wouldn't need ADD or ADHD medications. Making more errors or having more accidents. The more accidents is quite significant, um, especially in the healthcare field. Especially nurses and staff that work overnight, uh, that tends to mess up your sleep rhythm and sleep patterns. And so there has been a significant amount more of people involved in accidents who work night shifts, who get out of work tired and end up having an accident and killing someone or themselves. So that's really important. Another thing is having ongoing worries about sleep. I don't know how many patients I've gotten where they're like, I just can't sleep, and they kind of hyperfixate against that, and rightfully so. But unfortunately, it just kind of adds to the issue of not being able to sleep. So that's, somewhat of an issue. And I have a question here. Norma says, can we catch up on sleep by sleeping a few hours the following day? Okay, so you're talking about the following day. So what studies show is that sleep, essentially, once it's lost, it's lost. So let's say you sleep 4 hours at night because you have um, something that you need to attend to, and normally you sleep 7 or 9-ish hours. So the issue becomes these are not things that you can make up. So if you've lost them, you've lost them now. If you fall asleep or sleep, it doesn't mean that it may not serve a benefit, but what's recommended are short durations, like 15 to 20-minute power naps, and not something that's long term. Again, once you lose those hours of sleep and they're not consecutive hours, they're pretty much gone. So the answer to your question is no, we can't catch up on sleep. It's not something we can keep like calories per se, where, we need let's say 2000 calories today, right? Well, today I only had 1500 calories, and I'm like, you know what? I can do my 2000 calories tomorrow plus the 500 that I did from the day before. So I'll splurge on some pan dulce and have 2500 calories tomorrow. Unfortunately, that's not how sleep works. We're not able to catch up. Once you're gone, you lost it. You lost it. You're still going to be susceptible for the symptomatology that we spoke about. Again, feeling cranky, depressed, or anxious, having a hard time paying attention, focusing on task, and remembering things. And this is not remembering, these are not severe things like Alzheimer's, dementia, where you're repeating things and things of that nature. It's more associated with where did I park my car? Where did I leave my keys? What was I going to say? Sort of mild things that kind of get in the way of people's way of living. Again, issues with having increased errors or accidents, having a hard time falling asleep or staying asleep, waking up during the night, waking up too early, feeling tired or sleepy during the day. So I think that's what people complain about really the most when they're having issues with the falling asleep. I get so often that they're tired during the day. All right, and I have another question here. B says, are there any medical conditions that might be contributing to the insomnia? Absolutely. So there's two things. There's something called primary insomnia, where it's sort of there really aren't any causes that we can put our finger on to say, okay, this is what's causing the sleep disturbance. So that's known as primary insomnia. We also have another diagnosis called secondary insomnia. And secondary insomnia means that the insomnia and or the inability to sleep adequately is attached to something else, whether it be a side effect of a medication, whether it be a particular diagnosis like sleep apnea, where, now you're having to sleep with a particular machine on, and that's creating some issues. And so you're not able to sleep throughout the night as a result. So yeah, there's quite a few conditions that, can definitely contribute to lack of sleep. It's a pretty big thing. So I always tell my patients that when they're talking about sleep disorders, that they need to ask their primary care provider to reconcile medications. I can say in my weight loss program, I don't know how many patients have been on a tumbleweed of medications. I mean, just so many things mixed up. There's so many people in the medical team, and, I do primary work. And, if I send to cardiology, heart doctor, they see a heart doctor. If I send to lung doctor, they see a lung doctor. If I see to foot doctor, they go there. And all these doctors, one medicine here, one medicine there, another medicine there. So ultimately what happens, I've seen patients with 2 or 3 medications in the same class, medications that kind of go against each other, that are counterintuitive. And so it's really important that it's really the role of the primary care provider ultimately to review and reconcile medications and make sure that these sort of things aren't happening. And if they are, reduce the likelihood and make the changes as needed. So let's talk a little bit about diagnosis of sleep-related disorders like insomnia per se. The question is, well, how would we find that? How would we attach a diagnosis to a particular patient that they have insomnia? So a couple of ways. Physical exam. We want to look for signs of medical problems. Blood results, blood tests, excuse me, may be done as well. Again, we may look for things like thyroid related issues that can interfere with sleep. Um, Physical on physical exam, we may see somebody who has a larger midsection. We may see somebody who has really large tonsils who may be voices that they snore at night. So physical exam is extremely important based on looking at the patient, assessing the patient, and listening to their past medical history. We want to talk about sleep habits. How am I going to know what's going on with your sleep if I have no idea, if I'm not asking those questions? We want to ask about sleep patterns. We want to ask about daytime drowsiness and energy levels. So in my weight loss program, when I'm talking about sleep, there's a couple of questions I ask. I ask, are you having difficulty falling asleep? Are you having difficulty staying asleep? When you hit your pillow, how long does it take for you to fall asleep? And when you wake up in the morning, are you full of energy or dragging? So based on those answers, it gives me a bird's eye view of what potentially could be happening and what could be causing it, as well as how I can best treat the patient. Because whether they're having difficulty falling asleep or staying asleep, uh, and it's going to guide me to what my treatment is going to be specifically. Another way we can look at diagnosis is sleep study, and that's exactly the picture I have here. I have this gentleman where he has multiple, electrodes and monitors connected to him. And back in my old days, what used to happen is you had to go to something known as a sleep lab, and you had to spend the night there and sleep. And things like brain waves, breathing, heartbeat, eye movements, and body movements were being evaluated while you were asleep. But now they have more modern things where you can pick up a mobile kit and actually, connect yourself and then do this out of the comfort of your home. So I thought that was pretty nifty. For the reason being that I myself, for one, have difficulty anytime I'm not home, I have difficulty sleeping. So I can imagine that if I didn't have insomnia at home, that I definitely would have insomnia when they're trying to evaluate my sleeping patterns. Anytime there's something new, I have a difficult time with sleep. So that's a bit difficult sometimes. We want to talk a little bit about treatment. Treatment is pretty important. We want to know what can we do to reverse this, because remember, about 75% of people can do lifestyle modifications and end up ultimately resolving the issue of sleep disorders. So let's look at some things like cognitive behavioral therapy. Um, you know this has to do with like mental health related stuff. So a lot of times there is mind over matter. The mind is extremely important, and I actually watched a documentary about End of Life, where a particular patient had a diagnosis of cancer, and they looked at two different areas. They looked at telling the patient that they had cancer and that they were dying, when actually they didn't have these particular diagnoses, and they saw a market decline in how the patients responded and lived what they considered the last days of their lives, versus telling another patient that they are dying of cancer, and the patient, be in a place saying, you know what, I'm not going to worry about this. Whatever time I have, I'm going to live. I'm going to live a fulfilled life. And the moral of this story essentially was that mind really matters. For the person who thought they were dying, they really weren't dying, began to die. And the person who actually was dying, but in their mind said, I rebuke this, I'm not dealing with this, I'm not doing this, I'm fine, I have no problems, actually lived much longer. That the particular oncologist or doctor, whoever it was, said, okay, you have 6 months, they lasted 2 years plus or whatever. So mind really does play a huge matter in a lot of things. I have another question here. B says, can sleep apnea, restless leg syndrome, or thyroid might contribute to insomnia? Absolutely. Yes, yes, yes. Sleep apnea is a big one. And this is particularly a condition where you stop breathing for a few seconds multiple times throughout the night. And so when this happens, you're now obligated to wear a sort of machine that kind of blows air into your airway, so that this area is not collapsing and you're able to not have any periods of apnea, in other words, or where you stop breathing. Now, even though it's just a few seconds, it's quite significant, for the reason being that every time you stop breathing for a few seconds, your body responds by compensating. So your heart rate starts to increase. because your heart's like, whoa, I'm not getting any oxygen. I need to beat faster so I can circulate blood and give the vital organs oxygen. The issue is that the heart, being a muscle, gets tired over time, and so when the heart gets tired, it becomes enlarged and then doesn't work as effectively. So now we have, pump failure with the heart. And then now we suffer other symptoms like swelling to extremities, shortness of breath, at rest in extreme situations, cough that could be dry or with frothy sputum, and so that's a quite significant diagnosis there. Something like restless leg syndrome. This is a situation where patients feel like they have to move their legs. They're antsy. And these people literally get up out of bed and move their legs, like walk and or shake their legs, because they feel a great discomfort in the area. So imagine if you're trying to sleep and all you feel are issues with your legs where you have to keep getting up and out of bed, to shake your legs. It's quite significant. So these are things that need to be looked at. Thyroid can be another issue where if thyroid is hyper, and you're having more your metabolism is more increased than it should, then you may have symptoms like tachycardia, heart fast rate, um, and profuse sweating. So you may be uncomfortable and not able to rest like you should. So yeah, absolutely. A variety of conditions can cause insomnia for sure, or the lack of sleep. So, if we look here at cognitive behavioral therapy, this is where, the attempt to change our train of thought comes into play. And some areas where we could potentially help with this and do this is one known as stimulus control therapy. This helps train your body and mind to sleep better and not fight sleep. Examples include set a regular time to go to bed and wake up, not nap, and use the bed only for sleep and sex. Leave the bedroom if you cannot go to sleep within 20 minutes and only return when you're sleeping. I did a presentation for the military people, I don't know, probably about a year or so ago. And I told them, I mentioned these exact same things, that the bedroom essentially was designed not to sit up and watch TV and not to sit up and read in bed. Or me, when I was a student, I used to like to sit up in my bed and do homework online. This is not what it's designed for. It's designed for bedtime and, for sleep and intercourse. And the soldiers just thought it was the funniest thing when I told them, yeah, it's just for sleep and sex, and they got a big kick out of that. But I was extremely serious when I mentioned it, and I'll continue to mention it always because there really is evidence based behind that. So other things like relaxation methods, progressive muscle relaxation, biofeedback, breathing exercises are ways to lower anxiety at bedtime. They can help control your heart rate and muscle tension. So if you have a lot of muscle tension and you're not relaxed, then it makes it really difficult for the body to be like, well, I'm relaxed. Maybe it's time to go to sleep. Versus if you're extremely tense, then your body's going to be more preoccupied with things to lower and or reduce the tension. So you can do things like, again, deep breathing exercises, listen to you can do some guided imagery, listen to some spiritual stuff that can help motivate you in these areas. Um, Treatment, there's quite a few treatments, so we're going to talk about a bunch about these things. Sleep restriction, this is really important, and this is kind of what you piggybacked on, what you mentioned, Norma, sort of, kind of. What we want to do is reduce the time you spend in bed and stop napping during the day. I really tell my patients who have a difficult time sleeping that if they can prevent themselves from napping in the day, don't do it. For the reason being that your body needs to feel tired, it needs to feel used in order to be sleepy. So if during the day, all day long, you've done nothing but sit down and watch TV, then your body probably isn't going to be tired enough to be like, oh, maybe I've worked all day long and now I need to rest. Your body's going to be like, well, I've relaxed all day long. I don't need to sleep right now. I'm doing pretty good. And most people, when they're kind of sitting and sedentary, then they tend to want to fall asleep. I know that every time I sit, and it's not very often, but when I do sit and I watch TV shows or movies, the likelihood of me finishing this is slim to none because I'm busy all day long. My body's, going 1,000 miles. So if I'm sitting down, I'm out for the count. And worse if I'm laying down. So we want to restrict napping. If you're going to nap, if you must nap because you can't do without it, then I would recommend 15 to 20-minute naps. And that's it. Again, going back to my situation, I can't do that. If I sleep 15 or 20 minutes, that's literally nothing to me and I feel worse. If I'm going to take a nap, I'm out for hours. So guess who doesn't take naps during the day? I don't, because again, I'll sleep many hours during the day and then I wake up when it's dark and wanting to do things. So that's kind of the issue with that. Another thing is light therapy. If you fall asleep too early, then wake up too early, you can use the light to push your internal clock. So remember, we have what's known as a circadian rhythm. And so the issue is we're kind of in a place where when there's light, that triggers symptoms, signals in our body that says, oh, it's daytime, you should be awake. And on the opposite token, when it's dark, your body also triggers uh, a message that says, hey, it's dark, it's time to go to bed. And so if, we have a bunch of lights on in the room, then guess what? We're probably not going to be going to sleep that early or falling asleep at all because our body's going to be like, wow, there's so much light. So that's why I tell people not to be sleeping during the day or not to be putting on lights during the day for the reason being that, again, it affects sleep. So we shouldn't be watching TV in our bedrooms. Take the TV out of your room or don't use it if you don't have another place for it. Things like Alexas or alarm clocks or anything, cell phones, anything that emits any light whatsoever needs to be removed from the room unless there's a specific purpose for it and we're using this particular light therapy. And again, this would be used so that you fall asleep later because you're telling your body, wow, there's still daylight when it's actually dark, or um, nothing at all. So the room should be pitch black. If you need to put drapes in the room, then that should be, I recommend that. So again, I'm a legal drug dealer. And so one of the ways that I tend to remedy things are with medications. Um, and I will say that I'm quite frugal with medications though. So even though I legally drug deal, I am quiet. I don't just readily dish out drugs. I do try to have patients do other things before they try drugs. The reality is, especially with my weight loss patients, is if they're coming to me, the likelihood of them having tried other things that don't involve their primary care provider, they likely would have tried. So sort of with like weight loss, they would have tried to diet, they tried all these 1,001 fad diets and had no results. They would have exercised themselves to death and had no results with it. So they're kind of like at wit's end and they're like, okay, I've exercised, I've dieted. So that didn't work. So give me pills and let's just make life easier. It seems to be that easy fix for most people. So if we're looking at particular drugs who for people who have difficulty falling asleep, I would choose probably none of these, but this is what's recommended for, this is what research says are recommended for this particular condition. Lunesta, temazepam. This is a benzodiazepine. It's addictive and it's on the VAERS list for the elderly, meaning that it's a list of dangerous and not recommended drugs for them. So I tend to not use that. Again, the reason being that I tend to treat older adults, geriatric patients most. So you always have to think about safety for them, and the particular medicine, necessarily isn't the safest. Doesn't mean we can't use it, but we really have to be careful with things. Can cause things like aggression and hallucinations and stuff. I've had patients come and, the family members are saying that they're seeing things and, saying things that don't necessarily make sense. But if I had to choose one from here, I'd use Ambien. Again, I can count on probably one hand how many times I've used it, but if I had to choose, that's what I would choose there. Again, there's issues with things being habit forming. These should be more short term drugs and as needed, and not something that you should be taking every single night, as your body will now depend on these things, and it's a problem. So that's somewhat the issue. All right. And so B has a comment here. She says, or use a night mask. Oh, yes. So in the movies, because I don't see them very common, but in the movies, people, use those masks to cover their eyes, kind of like the horses, when you want them to go a specific place. Well, if you cover your eyes, then, you know, the the idea behind this is that light isn't hitting your eyes. And I think you're recommending that instead of the drapes, which probably is much more affordable, because I think these eye things are pretty cheap. They're not very expensive. But you are going to have that, elastic band or whatever around your head. And some people may not be excited to use that. But yes, absolutely. That is a viable solution. And so Norma says, so I guess sleeping with a light on will affect our quality of sleep. Yep. No lights on, no night lights. If there's something now, again, there a lot of things vary. So I have people, who are getting up in the middle of the night, maybe elderly, and tripping over things because there's no light. So there has to be a light that's within hand's reach that they can, flip a switch on or turn on, so that if they need to get up and go to the bathroom or get a medication and something, then they're able to do that. But that's really important. But there shouldn't be any lights, no candles, no night lights, no TV, no alarm clocks, no cell phones. None of this stuff should be on. So that's that's really important. And then B says, are there any non-medication approaches that can help sleep? Yes. And so that's what we discussed just a tad ago here. And let me go back to that. And you may have asked a question before I started talking about it, but I may be running a little late with questions. So we started here at things like mental health related cognitive behavioral therapy, like stimulus control. In other words, say you're going to go to bed every night at 10 and wake up every morning at 10. Initially you'll have to use an alarm to get used to that. But even if you're still sleepy, we don't want to extend that past 10, because then your body's like, oh, she gave me an exception this time. Guess what? I'm going to keep asking for exceptions because I just love to sleep. And so that throws off your routine. You should be trying to get up around the same time and going to bed around the same time, more or less. Now, it doesn't have to be exact, on the dot, but it should be pretty close to that. You can do other things like relaxation methods, whether it be progressive muscle relaxation, biofeedback, breathing exercises, so deep breathing, uh, listening to some soft music, guided imagery, so many things. Another thing that we can also look into is sleep restriction, meaning don't nap during the day. That's the whole issue. And if you absolutely must nap, it should be 15 to 20 minutes and not longer than that. Something else like light therapy. Again, if you are having issues where you're falling asleep too early, then you do want to put lights in your room so that you can push back your sleep pattern a little bit. You sleep a little later, and you're not, because obviously if you go to sleep too early, then you get your allotted hours of sleep and your body's like, okay, I'm ready to go. And it may be 2 or 3 o'clock in the morning when you wake up and your body's ready to go, but nothing is going on at that time. So, that's that issue. Again, we'll continue with medications that people can use. Now, for people who have trouble staying asleep, there are other treatments that we can use. Something like things like Lunesta, Balsamra, Trazodone, Doxepin. I tend to like Trazodone. I like that medication significantly. It does have some antidepressant properties that are very mild, but it can help people who already have mental health related issues. Um, it can potentiate or make stronger current mental health regimens like SSRIs or other pills that you're taking for mental health. It can help potentiate those results of the medication plus help you sleep. But that's really my drug of choice. When I'm seeing people struggling with sleep, that's usually what I go to. And what we want to know and think about is that sleeping pills, prescription sleeping pills, can have side effects, such as having daytime drowsiness and creating higher risk for falls. So we talked a little bit about the falls, about the room being dark and the older people not being able to see, tripping over shoes or throw rugs. We always want to make the environment as safe as possible. So we don't want to have shoes, or calzones scattered all over the floor. We want to, have the area clean. We don't want throw rugs because you can step on those things and, go slipping and sliding on the floor. And that can create a lot of issues. So I tend to not have shoes or calzones on the floor because if I do, my dogs will come pee on them. So my dogs kind of help me with this particular issue that, you know, I have to tidy up unless I want urine on them. We want to look at this habit forming issue with the drugs. Your body tends to get addicted because a certain stimuli happens. Like, I'm feeling sleepy, and I'm not able to sleep. And well, let me take a medication, and there's a reward for that. And you just kind of go in this, circle of death, if you will, where there's a reward. Your body's not sleeping, and so you get this reward of, let's say, the lorazepam or Xanax, and so now your body's like, I like how I feel with Xanax, or lorazepam. You know what, let me not sleep, because then I'm going to get a lorazepam or a Xanax, and that makes me feel pretty good. So it's kind of like a reward system when you have a child who's in the store and misbehaving, and they throw this big tantrum, and because they want a candy. And so in order for you to set them up, you purchase the candy. So you've now just told the child, anytime you want a piece of candy, throw a tantrum and you'll get the candy. And so we have to really change those behaviors in our body. So we have here some other comments. Let's see. So B says, I use them. And she's referring to that night mask. Um, and then I have Clarissa here. Hi, Clarissa. How are you? Thank you for joining me tonight, especially considering that you were a Ray's fan. So I'm happy that you're here, even though Ray's not here. I'll take that compliment. So B says also, I understand that sleep hygiene, exercise, and relaxation techniques help. Yes. And that's pretty much what we discussed about um, relaxation before sleep. All of this stuff is that we're talking about, really, that category is known as sleep hygiene, and things that we would do to help improve the areas of sleep. Exercise is another great one. We just have to know that for some people, right before bedtime, exercise may make them more awake. So we have to make sure that we're not doing exercise that is too strenuous. Should be something mild and relaxed. And what would that look like? Well, it varies from person to person. For some, it may just be, sweeping your floor if you are quite inactive. For people who are trainers and train at the gym, they may go out and do a full run, with a weighted vest and things of that nature. They may do a weight routine and still be able to sleep without issues because they're so conditioned. So again, it varies with everyone. All right. I'm just wanting to make sure I got all the comments, and I think I have. All right. Here we go with speaking more about lifestyle changes. So, what kind of things can we continue to do? Again, follow a sleep schedule. If you're going to go to sleep at 10, make that change, make that adjustment, and wake up at 10 or whatever time it is. Even if you're still sleepy, or the opposite, even if you're not sleepy, you got to get yourself into these routines. Again, our body is sort of a creature of habit when it comes to sleep. And so if one day I'm sleeping at 8, the next day I'm sleeping at 9, next day I'm sleeping at 10, the next day I'm sleeping at 2 a.m., your body is going to be like, what the hell is going on? I just can't follow you. And it's going to make it really difficult to fall asleep or when you should. Stay active. That was a comment that you mentioned, be about exercise. Schedule exercise at least a few hours before you go to bed. Do not participate in activities that cause a lot of energy too close to bedtime. We talked a little bit about that, about mild exercise and what that looks like. It varies from person to person. For some people who are extremely inactive, it could mean just getting up and washing their dishes or sweeping the floor because they don't do very much. And so, with that sort of exercise, it would be enough to increase their heart rate a bit. So, we have that movement. And again, for people who exercise, routinely, people who are in the gym or military people who have strenuous work schedules, it may take them a little longer, and they may be able to do more exercise, like even go for a full run, weighted vest and the whole works, or lift a bunch of weights and do a routine there. So it varies. Again, we talked about checking your medications. I can't tell you how many patients I've seen that have really messed up medications, and so every time I see them, I reconcile medications because that's extremely important. In order for people to be successful with medication regimens, we really need to know what they're doing and how they're taking them. Again, we can't assume that people always understand our instructions clearly. I had an example sometime in the past where I had a patient that came in for constipation, and I gave her some suppositories, which go in the exit and not in the entrance. And 2 weeks later, she came back, and I'm like, "Hey, by the way, how those suppositories work? How's your constipation doing?" And she's like, "Well, I'm not really sure, but they tasted terrible." Again, I assumed that, when I said suppository, that she understood that it went in the exit and not in the entrance. But again, so many things affect how we understand or perceive messages. It could be a learning disability. It could be a language barrier. It could be stress where they thought they heard one thing or understood another. And so, it's really important to look at feedback and ensure that they properly understood. So if we're giving somebody suppositories. Okay, ma'am, I'm gonna, we talked about the suppositories, do you understand how you're gonna, take them? Yes, I do. Okay, can you tell me how you would take the suppository when you're ready? And at that time, she told me she'd put it in her mouth. I'd be like, whoa, that's not what we're looking for. It goes in the exit and not in the entrance. I'm like, don't show me though, but just tell me. Because I do have some exhibitionist patients who are exhibitionists. Um, but yeah, let me see. I have comment here again. B says, I read that the best time to exercise is in the afternoon. I'll tell you what, it varies again from person to person. I have exercised first thing in the morning at 4:45 when I wake up, and I've exercised in the evening before bedtime. My personal experience, I like it in the morning for the reason being that it tends to give me energy. And especially initially when you're exercising, it almost seems like a task. And so if you wake up in the morning and you kind of get that task done, it's kind of like, check, it's done. And I didn't have to worry about it anymore. Now, I'll be honest, I didn't like waking up at 4:45 in the morning, but as soon as the exercise was over, I felt like, okay, I don't have anything to worry else about. I've done that. As it became a lifestyle, and I didn't have to worry about feeling the stress of, I need to get it done, I need to get it done. But I tell you what, it takes a few years for it to be lifestyle, and it can be easily broken. You miss a Monday here, Monday there, and that routine is screwed up, and then you need to start all over again. But in your case, if you prefer exercising in the evening, more power to you. For some people, it gets them, it relaxes them, gets them tired and perfect, which is a perfect setting for bedtime. So I'm not opposed to either. What I do realize that every body is a world, and we can simply discuss what research says and what has worked for me, myself, and I. But at the end of the day, each one of our bodies is different, and so what works for you may not work for me, and the other way around. So if that works for you, then I'd recommend to continue to do that for sure. So we talked about checking medications, reconciling medications. That's important. So many medications have side effects of lack of sleep. For example, my phentermine patients in the weight loss program, if they take that past noon, they're going to be up. And so I always make sure to tell them, or have pharmacy tell them that they shouldn't be taking this medication after noon. So they wake up and they forget the dose and they realize it past noon, skip it. Other medications like ADHD drugs or ADD drugs like Ritalin, and things of that nature. So a whole bunch of medications can cause the side effect. So we want to limit or stop naps. We've talked about this. If you must have a nap, uh, you know, it's saying here, try not to do past 30 minutes. I like 15 or 20 minutes. Um, but hey, 30 is probably not going to make a big deal. And try not to nap after 3 p.m. Again, if you're napping after 3 p.m., then it's just too close to your cycle of sleep, and the likelihood of it interfering with your sleep is more significant. We want to limit the use of caffeine, alcohol, and nicotine. So these are all bad habits. It's okay. We have a cup of coffee in the morning, maybe at noon, but not in the evening, and not the whole pot of coffee. And when we talk about caffeine, it's not just drinks, it's foods. You do realize that chocolate has caffeine in it. And so I know some people like some bedtime snacks, and they're like, I'll munch on a piece of chocolate. Guess what? That has caffeine in it, and that can keep you awake. Things like hot cocoa, teas, all of that stuff has caffeine in it. So you really need to look at, okay, is this not just because I'm drinking it, it's drink or eat. Alcohol. Alcohol is an antidepressant, essentially, I'm sorry, not antidepressant, a depressant, and has a depressive related symptomatology with it. The issue with alcohol is it can cause drowsiness, but it's not going to get you into deep sleep of REM. Remember, the whole goal of adequate sleep is not so much the time frame, but it has more to do with you getting into that REM sleep. So we have multiple phases of sleep. And the phase of sleep known as REM, and that's rapid eye movement. When we're in that particular phase of sleep, we're in a more deep sleep where our body is like completely flaccid. We're recharging our batteries, and the reason it's known as that is because your eyes tend to, twitch in that particular stage. But this is the stage of sleep that's our goal. We need to get to that stage. And things like alcohol, and over-the-counter sleep aids like night, what is it, NyQuil, Benadryl, anything that says sleep aid usually has Benadryl in it. Either has Benadryl and ibuprofen, Benadryl and Tylenol, Benadryl and melatonin, but Benadryl is a common medication. And Benadryl can create a bunch of issues. So it's pretty sedative, meaning that in the morning, you're likely going to have drowsiness and be groggy, again, risking you for injuries. If you have to get up in the middle of the night, you may trip and break a bone. And for men, it's a more of a significant problem because it increases issues related to the prostate. And so they can have now difficulty urinating as the prostate surrounds their urethra. So that's somewhat of an issue. So I don't ever recommend Benadryl unless we're using it for an acute, in other words, meaning a big allergic reaction that's happening like now, and it's devastating. Because even if you have allergies, the side effects are significant, And so there's other medications that we can use, like Zyrtec or loratadine, that just don't have those sedative effects as much as the Benadryl, because the Benadryl is kind of like one of those first generation drugs. And so as they made newer drugs, they looked at those side effects and improved those areas. So nicotine is another thing. These are all bad habits. We're not trying to, we can't sleep. We're surely not going to have one problem and now start another problem. And remember that the effects of this caffeine, alcohol, and nicotine can run over several hours. That's the issue. So we're trying to get to sleep, and we're not going to be, the effects of these things aren't going to be gone for several hours. Then guess what's going to happen? You're going to be up, tossing and turning for several hours. It's going to be an issue. Another thing that's really important is says don't put up with pain. So how many people exercise, I'm sorry, not exercise, I was reading a comment. How many people have pain and don't do anything about it? So arthritis tends to creep up at night, more in the morning when you wake up and right before you go to bed. And so I know I've had some really bad pain. I suffered kidney stones at one point in time, and there was no way in the heck that I was going to be able to sleep. I couldn't get myself comfortable. So if my mind is preoccupied about pain, 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 there's just no way that anyone is going to be able to sleep. So if pain is causing the situation, then address it. Talk to your medical provider and say, hey, I'm having pain here, I'm having pain there. There's remedies for the most parts of pain related issues. Um, So we want to continue with other lifestyle changes. Don't eat large meals or drink a lot of fluids before bed. Well, pretty self-explanatory with the fluid issues. What goes in must come out. And if you drink a whole bunch of fluids, then guess what? You're going to be up peeing in the middle of the night. If you drink caffeine, that can irritate your bladder. And if you've ever had bladder spasms or discomfort in that bladder area, then you know exactly what I'm talking about. And you'll be up, throughout the night having to go frequently. So that's an issue. We want to make sure that we're drinking less, again, whether it's just water or whether it's caffeinated beverages, eliminating caffeinated beverage for sure. And I usually have my patients not have anything 4 hours before they go to bed, unless it's a small sip of water to swallow pills. But people, they have that issue where they're, waking up at night going to pee, then it's more of an issue. More of a problem. And this happens usually more to men where they have prostate issues. As they age, the prostate enlarges, just doesn't work like it should, and creates a nuisance when it comes to urination. Again, we don't want to be binging at night, taking out your whole bag of chips and your bean dip and stuff at night. That's not what should be happening. A light snack is fine if it could avoid heartburns. But again, we don't want to be eating in your bed, none of that stuff. You want to make your bedroom comfortable for sleep. You want, again, emphasize that the bedroom should be for sex or sleep, should be dark, it should be quiet, it should be comfortable temperature. So, some people like it hotter. That's me. Some people like it colder. That would freeze me to death. And but whatever is, that comfort for you, then, do that. Um, you want to hide all the clocks in your bedroom. You want to even your watches, your cell phones. Again, we don't want any of this light happening, because then our body's going to think, oh, it's time to be up. And we definitely don't want to be on our phones, because that blue light, that light is problematic. Um, we want to find ways to relax. You can do things like have a warm bath or a massage before you go to bed. Uh, you know, create some sort of bedtime ritual, such as, again, taking a hot bath. You can read, let's say, a chapter in your book. You have a book, you read a chapter, and you're like, okay, after I read my chapter, I know it's time for me to go to bed. Listening to soft music to kind of relax you, doing breathing exercises, deep breathing, yoga, or praying. Do not try too hard to sleep. Some people fixate over this and it just increases the issue. the harder you try to sleep, the more awake you'll become. So if you're not going to sleep, then get up and do something and come back when you're ready to go to sleep. You can do something like, read, um, again, some of these rituals over here, read, pray, take a warm bath, etc. Again, when you're not asleep, get out of bed. Remember, bed is for two things. What is the two things? Sleep and sex, right? So if you're not sleeping or you're not having sex, then you shouldn't be in your bed. You need to get out and do something else somewhere else. And that be all. Um, I'm open for questions or comments at this time. I also want to remind you guys that if you have a particular topic of interest, I'd be happy to oblige. So post whatever topics of interest you have. We can choose something from there and present on Wednesday. Somebody had asked me, when I present. I'm on these shows every Wednesday at 8 p.m. unless I have some sort of, military related commitment or I die, I guess, then I won't be having these shows. But for the most part, I should be here. Again, remember, if you have questions or concerns, um, you feel free to use me as a resource. Text me at 956-640-6963. Especially if you're having difficulty sleeping, I'd love to help you sleep. I treat sleep-related disorders quite a bit and have been really successful with this particular area and a bunch of others. The important thing is we really have to find out why the sleep is happening. As B mentioned, there's two. She talked about we talked about sleep deprivation and how it could be related, whether it's not related to anything medically per se, and whether it is related to something medically. So if it is related to something medical, we want to see if we can reconcile meds or work with those particular diagnoses to better control them. And if not, then we'll get you to what you need. So please, again, if you need this, I'm here to help you. I don't charge for questions or comments or concerns, just for treatments. Norma says, I appreciate you taking the time to educate the public on different health topics. Absolutely. My pleasure. I enjoy doing so. The more people know, the more they have tools to better their health. So yes, it's something that I enjoy doing. And then B says, good job, Sharon. Good topic. Thank you. So guys, if you have, you know, again, topics that you may be concerned about or have questions about, I'm happy to oblige. If not, no worries. Don't stress your pretty little brains. I will create a topic for next week, and then we'll be here at the same bat time and same bat place. Juliana says, thank you for the information. You're very welcome. Whatever I can do for you guys. And that's essentially that, guys. If nobody has any questions or comments, then we're pretty much, good for the day. Okay. So thank you for joining me tonight. In case there's a question regarding Ray, I did not fire him. I promise. He got some busy with his chess business, and so he's not available for the moment. He says he could come back down the road, but I appreciate him very much. He got me through the initial stages of setting up this whole video chat stuff. So I appreciate him very much, and he's always welcome on my show. But that's that. So for the next few segments, it'll just be me, myself, and I. But of course, like I said, Ray is welcome to join anytime. I do plan down the road on getting other people on my show for different topics. So let's say someone's interested in a particular topic, I can always bring in experts in those particular topics so that they can discuss in more detail those particular topics. So, alrighty, guys, we are at the hour, so thank you for joining me. I appreciate each and every one of you, and I will see you next Wednesday at 8 p.m. Okay. Thank you. Bye-bye.